Good evening. The problem of home health care aides not getting paid in Ohio is spreading. Some have gone without pay for nearly 2 months.
The delay follows a change in how the state handles those payments. Tonight, we've learned agencies that employ the workers haven't been paid either. Local 12 reporter Jeff Hirsh continues his investigation that you'll see only on Local 12 News.
For the past couple of days, we've been showing you independent health care providers who have not been paid for nearly 2 months. In fact, at one home, 5 other aides showed up to express their frustration.
And with this here, I'm getting behind on my utilities, behind on my car payments and everything. And without this extra money coming in, I just can't make it.
The problem began after the state of Ohio Medicaid program stopped paying providers directly, with insurance companies taking over. But the providers say they have not been paid by the insurance companies since June 1st. The providers say they may have to quit to get other jobs and their patients will suffer.
He's a quad. He can't eat without somebody feeding him. He can't drink without somebody giving him water. He can't even do nothing without somebody helping him.
The state of Ohio has finally conceded something is wrong. This memo from the Medicaid department saying they've heard of certain billing issues being experienced by independent providers. But now we've learned the issue goes beyond independents who work for themselves. The Ohio Council for Home and Hospice Care represents 500 agencies which employ home health care workers. In a letter to a state legislator, the council outlines all sorts of problems and says it is clear the MCOs, those are the insurance companies, knew about the rollout months in advance and were not prepared for such a major shift in how Medicaid services are handled in Ohio. The council says many agencies are struggling due to cash flow problems from not being paid. One Cleveland agency has $300,000 in outstanding claims and was forced to lay off 10 people. A spokesperson for the Home Care and Hospice Association says he hopes to have a meeting in Southwest Ohio within the next 2 weeks to discuss this problem. The change from state payments over to insurance companies is part of a nationwide pilot program involving 15 states. In Ohio, different companies handle the claims in different parts of the state. In our area, it's Aetna and Molina. And most of the complaints we've gotten, not all of them, but most of them involve Aetna. Back to you.
Jeff, is it fair to say that the state yesterday and the day before when you were doing this story sort of minimized this problem?
They did when I talked to them, a few days ago. They said it was just, an isolated thing. And, maybe for 6,000 healthcare aides across the state, it is isolated, but we've been inundated. I can't remember getting this many calls on a story in years. So it's out there. It's a problem.
All right. Jeff, thank you. Great work. A spokesperson for Aetna tells us they are trying to deal with the issue. Quote, "We have identified the problem with our systems and are implementing processes to resolve this as quickly as we can. In the meantime, we are manually processing claims, increasing our check runs to twice a week, and, where required, offering cash advances to health providers."